Welcome. My name is Peter Strong. I'm a professional psychotherapist based in Colorado, and I provide online therapy via Skype. And I specialize in mindfulness therapy for the treatment of anxiety and depression. So if you're looking for online psychotherapy for your depression, then please go to my website and learn more about the online approach that I use. All my therapy sessions are done via Skype. This is not only very convenient for most people, but also it makes it a lot less intimidating. It's much more comfortable for you as the client, being able to have your therapy sessions at home rather than traveling to see a therapist in their office. So depression is a very important emotion to work on and not avoid. So many people try to just get through their days really ignoring their depression but suffering immensely from its effects. So one of the principal features of mindfulness therapy is that we do not avoid our emotions. The avoidance is a form of reactivity that simply feeds depression and does not help. So we must overcome the habit of avoidance. We must instead directly face our depression and work with it, and that's one of the primary focuses of mindfulness therapy. Depression is typically formed as a constellation of other emotions like anxiety, fear, a sense of helplessness, a sense of not having any control, a sense of guilt or shame or low self-esteem or emotional trauma. There are lots and lots of emotions embedded in this conglomerate that we call depression. Depression is not one thing, it's an accumulation of lots of different habitual emotional reactions. The avoidance simply causes these emotional reactions to get stronger and stronger until the depression becomes overwhelming. So we must instead start to focus mindfulness on our depression. We must learn how to meditate on it in order to see the individual component emotions, because to heal depression you have to heal the underlying fear or sadness or guilt or shame or emotional trauma. These individually need to heal. When they heal, the depression heals. So that's very important, and that's why we learn how to meditate on our depression. We must make it central so that we can uncover the underlying emotions and help each one heal in turn. The biggest problem that avoidance produces is that it tends to cause these emotions to become isolated, to become abandoned, essentially, and when they remain on the fringe and not seen clearly, then they start to gain greater strength. So bringing the emotions into conscious awareness is central. So that's one aspect of mindfulness therapy. It's learning how to bring in our emotions from the outside so that we can develop a compassionate and very conscious relationship with them. But in so doing, we have to learn to form a conscious relationship with them rather than simply becoming consumed by them. So that's part of training in mindfulness, how to stay present with your emotional pain without becoming reactive, without becoming consumed by it, without becoming identified with these emotions. Developing this objective consciousness is an essential part of healing. Another very important part of the mindfulness approach is to develop a conscious and non-reactive relationship with all of those patterns of reactive habitual thinking or rumination that feeds the underlying emotions. And that is something we train with as well by looking at the emotions directly and then looking at the thoughts that get activated in reaction to the emotions. We have to work with those thoughts in the same way to see them clearly, but not to become overwhelmed by them and not to become identified with them. And another part of this outer layer of reactive thoughts that we have to look at are reactive beliefs about who we think we are. These beliefs also have the effect of reinforcing the depression if we become identified with them. If we do not become identified with beliefs about ourselves, then those beliefs do not have any effect on our well-being. It's only when we become blindly identified with our beliefs that the problem starts. So seeing these beliefs very clearly in an objective way is central. Another really important component in overcoming depression is to look for reactive behaviors that feed our depression in the same way. All reactivity, whether it's in the form of emotional reactivity, cognitive reactivity, or behavioral reactivity, has the same effect, which is to reinforce the underlying depression. So we have to look for behaviors that basically feed the depression. This can include addiction and avoidance behavior. It can include distraction, trying to take your mind away from painful emotions. That is a form of behavior that will simply reinforce the underlying depression. There are many different forms of reactive behaviors that simply contribute to the problem. Addiction is certainly one of the main ones that we come across. So if there's reactive behavior, same thing, we need to meditate on that behavior to find the underlying emotions that are triggering that behavior. For example, that are triggering addiction. It's only when we develop a conscious and mindfulness-based relationship with our emotional pain that we can ever expect that emotional pain to heal. That's a central principle in mindfulness therapy. So developing this internal, conscious, mindful relationship is central. Then we have to develop that relationship further to be one that is based on compassion. We have to learn how to be compassionate towards our emotions and towards our thoughts and towards our behaviors. This compassionate relationship is what then starts to change the mindful relationship into being a healing relationship. So we learn to work with our emotions with compassion. We learn to make friends with our emotional pain. That is an absolute requirement for healing. If you cannot relate in a loving, compassionate way with your emotional pain, then it will not heal. So this is very important, to establish inner compassion and friendliness or love. This is bringing the higher part of your being, we call the true self, into relationship with the part that is suffering, which is the little self. In our sessions together, I will teach you these mindfulness-based methods of how to work with depression. We will explore in great detail all of the different reactive formations, whether they're thoughts, beliefs, emotions, or trauma, whatever it might be. We will learn to work with those using mindfulness to promote healing. And healing is our primary objective. Mindfulness is more than just seeing things, and it's more than just accepting things. It's about healing that internal suffering. And that is the central focus of mindfulness therapy. If you would like to learn more about how to work with your depression using mindfulness-based psychotherapy, then please do contact me so we can schedule some online therapy sessions together. This very direct approach to working with your emotions is very effective, and most people see substantial improvements within a few sessions. The real issue for most people is that they do not establish a mindful relationship internally with their emotions. They try to escape them. They try to push them away, and that will not work. You must build a conscious and compassionate relationship with your emotional pain in order for it to heal. When you do that in a very detailed way, then your depression will heal quite quickly, and it does not require medications. In fact, medications may provide a short-term relief, but of course the medications do not help you heal the underlying emotions. So if you'd like to learn more, please contact me by email so we can schedule some sessions. Thank you.